Sure.
It's more lifestyle.
Exactly. So
Okay.
yeah, because this era has become an era of non-communicable diseases. And last week I had cases that really got me. It got me humbled.
Wow.
Yes, cases that got me humbled. Cancers, chronic kidney
Wow.
diseases. It really got me humbled because the age bracket were not far from mine.
Wow. Yeah.
Yeah, so it really got me humbled, and I wish, we could do a lot of changes, lifestyle changes
Yeah.
in our daily
Yeah.
lives.
Yeah. Very interesting. Moderation is key, right?
Sure.
Moderation is key.
Moderation and even abstinence at all.
Yeah.
Okay.
Because I know some people are pretty stubborn when it comes to certain things they do.
Yes.
But you're thinking the long haul and how it affects you. And it's not a good place to be when you're unwell, eh?
Exactly.
Because this weekend I had a flu cold something and I wasn't my best
You see,
self.
even with the common cold and flu, how you struggled.
I wasn't my best self.
Yes. So come to think of somebody who is having a cancer or not diagnosed yet, but everything looks like.
Yeah. I can imagine. I can imagine. God help us.
Yeah.
All right, Dr. Owusu-Ansah, you're welcome back.
Thank you.
Welcome back.
Thank you, Natalia.
So we're still on our series on STIs. We have talked about chlamydia, which you mentioned that is much easier to treat.
Exactly.
And then we talked about neurosyphilis, which is very difficult to treat.
Right.
Okay, so where are we this morning?
Right. So today I wanted us to see if you could open the phone lines for people to share with us what they've learned so far.
Oh,
and
okay.
how they are dealing with some of the things. And then there's one thing that I will also want us to touch on,
Okay.
Which is the HPVs, that is the human papilloma virus.
Right.
Another common STIs that's is also leading to some of these chronic cases.
HPV.
Yes.
Okay, so let's have the conversation on HPV. Then towards the end, we can open the phone lines.
So HPV is just a human papilloma virus. It's actually a virus.
Okay.
Yes, and then it has about 6 to 100 species of them. But few of them causes life-threatening.
Wow.
And then few also causes signs and symptoms. So we call them the strains. About 30 out of the 100 cause strains that you actually see signs that you're having the HPV. However, they are there. Yeah, they are very common. It's from a person to a person, somebody who is actually infected, and then when you get in contact with the person, you get it.
Okay.
The most dangerous aspects about it is that it's contagious by skin contact.
Yeah, that is a problem.
Right. So
so when you say skin contact, it means that a hug can be dangerous in this.
So not necessarily that. So if I have some of the strains actually causes warts. So there's something we call warts, skin warts. We have skin warts, we have the genital warts. So the warts is like a rashes, but it's a bit bigger. It could become so big, and then it has this characteristics of cauliflower.
Okay.
You know that's vegetable.
Yeah.
You see how it looks like. Yeah. So that's how the warts looks like. And then you could have the warts in every part of your body.
Okay.
You could have the genitals, you could have it under your armpits, you could have it in around your faces, you could have it on your neck. So if you have this warts and probably it's broken, and then you give somebody, like you said, a hug, and then you have a direct skin contact from this warts, it could actually
then contract
the virus.
Okay, that's very interesting.
Right. Yeah. So, like I said, few of them causes life-threatening diseases like cervical cancer.
Okay.
Yes. So that's why it's more important for women within this age bracket of 30 to 35 or 50 years, they do the pap smear to check if they have this disease or have this virus. And then the men will also have the genital warts around them. And then they find it very shameful. They feel like, oh, this thing, it's very shameful to take it to a facility because they could actually deform the integrity of your penis.
Okay.
Yes, and you see them, most of them at the consulting room, they come and say like, for almost 5 years, I've not had sex because of these rashes. They normally attribute it to as a rashes. It's it's not rashes. When you look at it critically, it's not actually a rashes, so it's called warts. And then women also have pubic rashes, and then so the treatment is sometimes not favorable.
Right.
Yes, you do a surgical removal of the warts, but thank God with our facility we are able to put a plant-based medication for you to take, and then it eradicates the virus from your system, and then also eliminate the warts from the genitals.
Okay.
Right.
Wow, that's interesting. So with this one, HPV, how is it cured? First of all, outside of the warts, are there any other symptoms that people should look out for?
Good. So you have the warts, you have the burning sensations. Yeah, wherever that you have the infections, you have burning sensations.
Okay.
Yes, and then it could also cause us itches.
Okay.
Yeah, you have body itches. If you have the generalized infections, you have genital infections, it could actually have itches. Like I said, it could lead on to most of the, terminal disease like cervical cancer.
Okay.
And then, sometimes it could also go to the prostate glands to go and cause inflammations and then leading to prostatitis.
Okay.
Right.
So these symptoms, do they happen at the same time, or is it one after the other, or you could just have one symptom at a time or one symptom maybe for a very long time, or how does it work?
So depending on the type of strain that you have, like I said, there are about 100 different kinds of HPVs. However, it is only 30 of them that causes, noticeable characteristics or clinical presentation. So if you have the ones that could cause or give you the cervical cancer, cancers don't necessarily give any signs and symptoms.
Yeah.
But then there's something we call cervical dysplasia. So the cervical dysplasia, actually, you will not see, you will not use your physical eyes to see. That's why we advise they take a pap smear. Yeah, so the pap smear always do it.
Will help you.
Yeah, it helps us. And then also the men will do prostate scan also to see if you have an enlargement, you have a hyperplasia. Sometimes we call it BPH, benign prostatic hyperplasias, then to see if your prostate enlargement or your prostate gland is getting enlarged or is getting inflamed. Yeah, so with the signs and symptoms, it depends the ones that the kind of strain that you are infected. However, with the HPVs, they are with us. Almost everybody has the HPV. It's very, very common. It's even common than the chlamydia infections.
Okay. Yeah. And how are they treated?
Yeah. So thank God the WHO has come out with a vaccination. So just that they're expensive.
All right.
Yes.
Okay.
So if you're lucky you haven't been infected yet, then you could actually look for the vaccine. If you have the infection, like I said, it does not really or necessarily gives you the signs and symptoms early. So probably you wait to see if you're having unusual rashes. Like I said, people normally call it rashes. It's not, so it's warts. So if you have the warts, sometimes you have the warts inside your palms, you have the warts under your feet, you have it around your penis or your genitals, your pubic, the perineals. If you have any unusual rashes, which is so hard, which looks like a cauliflower, then probably you need to
see a doctor. Okay.
Care practitioner.
Okay, and they would give. Are they treated with antibiotics?
Sure, it's treated with antibiotics.
Yeah, and are they easy to treat?
No, the warts is not easy to treat. So there are other things sometimes when I come on radio like this, I don't want to mention because they could actually go and buy them. They are not counter.
So don't mention.
So
mention.
They are not counter medications. You actually need a prescription to buy them. So you will be seeing a doctor to prescribe this thing for you, and then so that kind of a solution you buy from a pharmacy will show you what to do. So if you don't want to go that way, there's an alternative way to manage or to cure the warts, and which we have it at our facility.
Okay, that's interesting. And so with the treatment for this, is it only when you take medicine through your mouth? How do you call it? Oral, right?
Yeah.
Is it only through oral medication, or are they topical?
Yes. So
Okay.
Good. So there are two. I like that tangent because somebody might see the outer presentations or outer clinical signs, and they will just go and get some topical applications and do it. However, the virus is within your system. It's in your blood, so you have to take some oral medication to also tone down the infection or just get rid of the virus from your blood.
So in this case, you're going to have to do both.
Exactly.
Okay. To help with HPV.
Exactly. Yeah. So HPV, it's one of the silent infections which must be feared because it could actually depress your or suppress your immune system. And in every area of health, our immune system supposed to be on top, just to fight away infections. But then when you have HPVs, gradually it suppresses your immune system, and then it could pave way for a lot of infections to get into your system, and then, just to damage the systems.
Right. Okay. So if anybody is experiencing the burning sensation, if you realize that you have this rash,
burning sensation around your genitals,
if you have the rash also around your genitals or on your skin, could be on your face.
Yes. People feel like cocoa. You see some around people's faces. You see some around their necks, and then they said it's cocoa. I don't know whether you've experienced some before.
No.
People have this tag. So the
skin tags.
Exactly.
Okay.
So when you look at it critically, then you could see that it's a what.
Okay.
And then people call it cocoa.
Right.
Cocoa.
I think I have a skin tag, but it's like here. In the middle of my brows. Isn't that strange?
Yes, that's strange.
It's been there for as long as I remember.
So probably one day we'll
examine it.
Yeah, we'll do with that the marks, the paint.
Yeah.
Or the what do you call it?
The
drawings. So
the drawings. Yeah. So these are what we call skin tags.
That's what we call skin tags.
Right.
However, you need to look at it critically to
see what exactly it is. And skin tags, do they come from birth or do they develop over time?
Yes, they develop over time.
Okay.
So it all comes from some of these, HPVs.
Okay. Right. That's interesting. Very interesting. All right. So you want us to open the phone lines now?
Sure.
So that we can have... Okay. So call us 0535 183 317. 0535 183 317. If you have a question for Doc with regards to STIs, all the STIs we've discussed so far. So we talked about chlamydia, we've talked about neurosyphilis, and today HPV. Or if you have experienced any symptoms that you simply do not understand, and you're looking to get answers for it. Doc is here with us this morning. Dr. Owusu-Ansah is here with us this morning. So call 0535 183 317 so that he can answer your questions for you or direct you to
the
right place where you can get the help you need.
Exactly.
Why is it that people are ashamed of their illness? When people get ill, they are ashamed of it. So sometimes it's such a big deal for them to go to the hospital like, hey, a doctor friend once told me that there's nothing you would take to the doctor that will surprise him.
Exactly.
right? Doctors are not surprised by the things they see because they see so
many things.
So he's not even thinking about you.
Yes.
Is that true?
Yeah, it's true.
Okay.
It's true. You've seen it much, for a lot of things has happened. I mean, during your training and then probably to your actual practice. So there's nothing new, when it comes to medicine, except probably you go to the hinterlands. My case like this, I go to the villages a lot, and then sometimes you see cases that, this seems to be weird,
This is quite the surprise.
Exactly. However, because it's the medicine, you try to, help
deal with
it. And then when you say people are ashamed or like they feel shy of going to the hospitals with their problems, it depends on where they have the problems. It depends on where they're having the condition. Before I left consulting room, there was a case that came, and I am actually updating our system of patient entry, and it's a new app. So we needed those who developed the apps to be with me at the consulting room. And when the guy came, it was issues with STI, and he was reluctant.
Oh, because there was a third party in the room.
No, we were like three. There were two girls and me, myself.
Ish.
And he started like, my testicles are painful. And then he looked at my face. He went to look at the other lady's face.
But in a case like that, is it possible that maybe the ladies could excuse the both of you?
Of course, I made them
go. Okay.
Yes, so I made them go.
Because sometimes it's not so much you saying your problems to the doctor. Sometimes it's like, maybe if the nurse B is there, and young men, maybe the nurse is some good-looking nurse. It's like, hey, na nurse you'll be massive.
But at the end of the day, they will read your history. So this one who made me.
Yes, if they are reading the history, I'll not be there. So
at
I don't
the end of the day, these girls are going to key the entries. They are going to key the data. So they will see everything.
Yes, but at that time they are keying it. The boy will not be there. He's gone.
Left.
So his problem is not about what they'll see later.
No, Charlie, you see, when it comes to sickness, you should not be shy.
Yeah.
You should not be shy of it. In Akan, they say, one time we are. So what I say. So why would you be in a consulting room? There was a case that had, and when he came, it was like, Doctor, wait me, I'm green and white, no, with Piabo and Kakra.
So usually when they do that, then you know that it's something that has to do with their penis area.
Their genitals.
Their genitals. Because otherwise, if it's a headache or something with their arm or something, they'll say it comfortably.
You see, so it's just a piece of an advice for people. Whatever being the case, they should not be shy of presenting what they are actually going through. And they should give us a vivid presentation of what they feel.
They feel.
Yeah, because sometimes they give you just the surface of what they are going through, what they are having. Then you have to do your direct questions. After the direct questions, that you see the proper things that they are going through. And sometimes I don't get it, and it's kind of heartbreaking.
I can imagine.
You have this thing, and you have opportunity to come to the clinic. You are with me and you alone. That one too, you can't say it. Then where else can you express your pain?
I can imagine. So here's what's going to happen, Doc. I think that maybe you should give your personal number out, because I want to assume that just like we're discussing, this is the situation where to call on radio to talk about what is going on might be a bit of a problem. Right. So maybe if they have to call you personally, I think that will work a whole lot better.
Right. That's fine. So my contact is 0243 768 216.
Okay.
0243 768 216.
Okay. So, I think we have a caller. All right. Hello?
Hello.
Yes. Good morning. What's your name? Where are you calling from?
My name is Bismarck. I'm calling from
Okay.
Agenda.
Okay, go ahead. Doc can hear you.
Okay. So I'm having some pains in my pennies, and I'm calling to find out what I should do about it.
Pain at where?
In my pennies.
Okay. So when you say your penis, that's the genital, that's the organ. It has segments. So you have the tip of the penis, you have the middle, and then probably the last point. That is where the root is. Where exactly you have the pain, and how does the pain? Is it during urination, after urination, or after erection, or after you have intercourse?
It's just after any moment I feel that pain.
Urination, right?
Yes, please.
Okay, please, how old are you?
I'm 20.
You're 20s.
28 years, yeah.
Yes. Okay. So it could be a urinary tract infections if it's not having any penile discharges. It could be a urinary tract infection. So if he has a health doctor, a professional, you should see it. You shouldn't joke with it. I mean, issues with a urinary tract infection, probably it's early signs, but then if it goes on to become chronic, it could actually go up and go and infect the kidney. So please, I didn't get his name.
Bismarck.
His name is Bismarck.
Bismarck. So please don't sit on it. See a doctor immediately. Urinary tract infections are very easy to treat. There are a lot of antibiotics. There are a lot of treatment for it. If probably you've done the antibiotics and you are not getting solution, we could get the alternative ones for you. So, like I gave my number, you could contact me, and then after the program, and then we'll see what to do to help you. Okay?
Thank you very much.
You're welcome, Bismarck.
All right. Thank you so much. Okay, so Doc, please repeat your number, right, so that I'm sure there are more people who would want to call, but soon say radio, so they may want to do a direct contact.
That's good from Bismarck.
It is good from him, but not everybody can be so bold to talk about. So if you can repeat your number, I'm sure they can reach you personally and talk about their concerns.
Okay, so the number is 0243 768 216. 0243 768 216. One thing about the urinary tract infections treatment is that most of the people who have been developed resistance to some of the antibiotics because they take 2 days, 3 days, 5 days, they are fine, and then they stop.
And then they come. And I realized that UTIs can be recurring.
Exactly.
It's like
very,
so
very
you can
common.
wake up every week to a new case of UTI.
That's true.
But I think lifestyle also helps with UTI.
That's a personal hygiene.
Yeah, I have found that lifestyle really helps with UTI.
It comes with a personal hygiene.
Yeah.
If you're a gentleman and you wear one boxer short for almost 5 days, what do you expect?
Then there's a problem. Okay, Doc, so how will we wrap up on HPVs?
All right, so HPV is concerned, and we are lucky now we have the vaccine, just that it's expensive.
Right.
But please look for it.
Okay.
For you personally, I would advise you take the shot.
I think I have.
You've
yeah,
had
I think
it.
I have.
Okay,
I think I have. But how long does it last though? Because I think I have many years ago. I think I have many years ago.
So let's get. The problem is we are not getting the kits, to actually test if you have the HPVs. However, we are actually vaccinating just to prevent, because it's very common.
Right.
It's very, very common.
Okay.
Especially ladies, and we want to prevent the cervical cancer issues. So please.
And doing the pap smears are also very good.
Yes.
I think I had a conversation with a colleague, and she said, "Oh, she's never had a pap smear," and I thought, "Oh, wow." Why, and she said, I've never seen, reason to do it. But that's something that, I advocate a lot. Like, it's always good to know, especially if you're sexually active. A lot of these things are important. So
that's what Ghanaians don't know. They don't want to do. They don't want to know what's actually happening in their systems.
No, you need to know.
They don't want to know.
You need to know.
They don't want to know. And even those who are privileged to know are denying it. They are denying it. You tell them and say, Can you imagine that? You've actually done series of investigations and you've come out with, accurate diagnosis. I had a lady who came, she has gone through all the laboratory investigations. We've done chest x-ray, you saw that the heart has enlarged.
Wow.
We did ECG, we saw that the ventricles were having problems. Yet she said, hypertensive. She has refused to take her hypertension medication, non-compliance.
Oh boy.
You see, all of us believes in faith healing. I'm a doctor who don't look down upon anybody's, beliefs in whatever that you think works for you.
Yeah.
However, I insist that do the medical approaches. Okay, go through all the medical approaches and then pray and then add your faith to it. That's it. But you don't leave the medicines aside.
Yeah.
Don't throw away your diagnosis aside and say,
let the doctor play his role and let God play his role.
Exactly. And it is actually causing a lot of problems in families. I have a condition right now, I'm dealing with it. Patient came on Thursday and he was a diabetic. He has been a diabetic for 20 years. 20 years. And then the wife said, my husband is Osofo. And, he 1 a.m., he will see the husband eating, a diabetic patient. Will go to programs, comes late, eating just anyhow. Now, to go and see how he's looking now.
Oh, boy.
Very pathetic. Coughing. If you cough, if he's here and he coughs and you're downstairs, you could actually hear the cough, the sound of his chest. All because God will heal him. So he stopped all the medications. He stopped anti-diabetics medications, he stopped antihypertensives, and then he was doing faith healing. I don't dispute that. For Christ's sake, we are all spiritual beings. We were spiritual beings before we became physical.
Yes.
Okay. However, if this thing is not strong enough, your spiritual will not stay.
True.
If your physical beings are not strong enough to house the spirit, you will go.
Oh boy. Thank you, Doc.
Thank you very much.
Thank you so much. So, again, let us know where you're located and then.
Right. So, Healthy Soul Medical Center, we are at Kaneshi. Yes, Kaneshi. After the small overhead, you will get there and then you will see Healthy Soul at the store building where the Metro Mars, they are loading to Uniba and Cape Coast. Yeah. Okay. We work from Mondays to Saturdays. Monday to Fridays, we close at 5 p.m. and then Saturdays, we close at 2 p.m. So, you call me anytime. Last night, somebody called 12 a.m. Just now that I look at the time, he called because I was far asleep. The call came out, just pick up, and the person was just talking. So my phone number is 24/7 because I'm dealing with human beings.
Okay. Right. Thank you, Doc.
Thank you
so much.
Me.
All right, so that's it for Doctor's Note this morning on The Zone. My name is